welcome to another episode of Got Therapy, and we are continuing our celebrity Got Therapy edition. Last time it was Charlie Sheen, I believe, and this time we're going to talk about Miranda Cosgrove. And I was talking with Dr. Baltimore earlier. He's not very familiar with Miss Cosgrove. She is...
Can't say that I am, but we'll try. Go ahead.
She is the star of the tween sitcom iCarly.
Oh, iCarly. Okay, now I put that together. Yes, I know a little bit about iCarly, but very little.
You should Hulu that, or
I should.
whatever the kids are doing
Netflix
nowadays.
that. Yeah,
and
that's
Netflix,
right.
whatever the kids are doing. There was an interesting article in the New York Magazine about how the Disney people are attempting to sort of navigate Miss Cosgrove's development into adulthood, to sort of avoid some of the pitfalls of some of the other former tween stars, like Britney Spears or Miley Cyrus is someone who's recently had some trouble. You may be aware of that.
Well, yeah, sure, but you know, it's sort of the Hollywood syndrome piece of it. Growing up as a star, and I mean, this has been going on for a long time with the children who basically are television stars, movie stars, and they grow up through and they find themselves in a very isolated way in terms of their development, and they're often we see them in the news with something going wrong in their relationships or something that brings them either some brush with the law or some kind of substance abuse or some other kind of problem like that. So,
like the Mickey Rooney cannibalism scandal.
Well, I don't know about that. I haven't heard about that, but yeah, I think these are general kind of concerns for these people. Are they really following a normal path of development so that, you know, and there are a lot of theories out there that say you really need to progress developmentally through a process that takes care of all of the needs and the issues that help you become a fully functioning and adult and do well in the world. So
again, I just point to Mickey Rooney because it just ended horrible.
Well, I don't know about that one, but we'll try to move on. But I'm thinking
he ate a pool boy.
Okay, this is not where we're going. I don't think in this conversation, but it seems to me that there are some real issues around, and I understand how Disney, who have obviously they have a big investment in her career to be able to keep her on the straight and narrow, out of the news, out of the tabloids, and doing okay, because that represents profit for their network and their company.
But because I do think there's something really abnormal about growing up under that sort of scrutiny and whatnot. But I think what I took away from the New York Magazine article is you could look at their development is actually fairly typical, and that there's something initially awkward about making that move from being a child to being an adult, how you deal with sexuality, how you begin to, there are a number of things that begin to come online developmentally at a certain point. And I was thinking, as I read that article, I was thinking, particularly, I think both men and women have sort of different hurdles they have to jump developmentally, right?
Sure.
But with women, I think there are, particularly around sexuality, there's some remarkable double standards. Right. And like this notion that somehow you are 14 or 15 and you are somehow completely innocent, you don't have any sort of thoughts or feelings, and then you're supposed to make this leap into adulthood without any sort of sense of development of that element of yourself and how you would integrate that.
Well, yeah, and you see that there's this very quick move into the sexuality piece where makeup and dress and so forth, and we see that from a marketing standpoint in the media and so forth. So I think there is that double standard, that innocent childlike quality, and all of a sudden that movie starlet type of position that you see these that women, in the general sense, I assume, but especially with these Hollywood stars, where that becomes part of their personality, and they're expected way beyond the time that they should. Let me put it like this: I think they're moving so fast in that development that they may skip some of the normal developmental tracks that people would go through to understand rights and wrongs, the choices, the appropriateness of some of these things. But
and when you said that, I was thinking about how developmentally, we make mistakes and we learn from those mistakes, and whatever the consequences, that sort of assists us, I think, in integrating aspects of ourselves. But if you have a camera on you, and then if you have this public persona that you're not supposed to deviate from it does create, I think, a potential disaster.
Well, yeah, I mean, in a way, there's probably some isolation that is involved in this, and so some protection about that. And maybe in some of those cases, they don't get feedback if they're not with a peer group. Peer group and parents and other family members, aunts and uncles and large extended families, you get feedback as you're growing up about what's right, what's wrong, how to self-correct, and you get that information that allow you to sort of adjust in ways. And maybe for some of these folks, they don't get that type of feedback. And in some cases, they may, in that celebrity status, it may be that you can't do any wrong. Everything you do is wonderful, and look how wonderful that is, as opposed to some corrections along the way that allow the person to sort of adjust in a more appropriate way.
And as you talk about that, so there's the piece of this that makes it sort of unusual and weird. I guess I was thinking too about the part that sort of makes it that there's something about the way they navigate this that reflects the way all of us to some degree have to navigate this. Right. And I was thinking, as I always think, it always go back to Freud, because everything should go back to Freud. Am I wrong?
You want me to agree with you on that? Yes.
Yeah, that's right. So I was thinking about how, particularly when you talk about sexuality and development of sexuality, one of the things that I think that made Freud both controversial and I think ultimately right is the idea that sexuality is something you're born with. That you have we have images of children masturbating in the womb. So there is a propensity and a capacity to be able to experience sexuality from the very beginning. And part of the process of socialization and the whole reason for culture is to find a way to contain that and direct it. And so there's sort of a war or a struggle from the very beginning in terms of where that's going to be directed and whatnot. And I think particularly with women, I think that you're allowed a certain level of sexual expressiveness as a male that you're often not allowed as a woman. Or at least it's conflicted. I think that there's something about the way in which particularly young women are either overly sexualized or under-sexualized. It seems to be there's no real happy medium in terms of meeting them where they might be, or providing maybe the sort of role models or cultural support to be able to navigate between those 2 points, if that makes sense.
No, it does, and it's conflictual. It has to be a conflict. And where does the child growing up to be a woman? How do they figure that out? We've you see a lot about body image and eating disorders and some of those other kinds of things that result in the symptoms that probably come from this conflict, the sexuality conflict that they're having, this innocence with the being a sexual being and fitting in to the age group and peer group and so forth. So I would imagine that a number of symptoms, if you will, that maybe need to be addressed through their development, or maybe even coming into counseling, coming and talking with someone about these kind of things to sort it out, need to take place. So,
in fact, I think that brings us, again, where we always should go, back to Freud.
Right.
And the idea that conflict can give birth to symptoms, right? And so that sometimes the weird and crazy things people do, like for instance, we could go back, some of the acting out that some of the tweens started. Recently, Miley Cyrus was caught on video smoking. It's a legal marijuana substitute, saliva, I think it is.
Okay.
And she was smoking in a bong.
Okay.
And you could even look at that as a potential sign of a symptom. What if she is conflicted and she is finding a way, at least unconsciously, to act out this conflict and to sort of force the hand of society and culture to be able to register aspects of herself that she couldn't otherwise get registered if she didn't have that sort of conflict.
Right.
Does that make sense?
Yeah. Oh, absolutely. And there was another example. I think even this week, maybe yesterday, Lindsay Lohan coming out of a nightclub and falling, and boy, the paparazzi were right there to get all of those pictures. Everything is covered in the media. Just the normal everyday activities, and plus anything else that could be sensationalized is covered, caught on video, caught on film, put in a photo, put on the newspaper, and you gotta know that's it's part of this sort of off-track development. Can you imagine that everything that you do is sensationalized and put in a newspaper, and then what does that mean to you as an individual? Do you have to live up to some standards that are just inappropriate or too far out there that leads you down a different path? Yeah, I think you're right. I think these symptoms come from that conflict with that a person is struggling with, and to find a balance to really be themselves, develop in a way that is beneficial to them.
And when you say that idea that there are these sort of ironclad standards, and I think that we also could go back to Freud, because that'd be cool, but I mean Freud. So this notion of the superego, this notion that there is, that if we don't measure up, that we find a way to punish ourselves. That there's also this notion that Freud talked about, the ego ideal. So there's an image that we have internalized about who we should be and what we should be.
Right.
And I think maybe in Lindsay Lohan's experience.
Lindsay now, by the way.
Yeah, Lindsay.
She's dropping the Lohan.
That's right. It's Lindsay. You did that. That's hip.
That's it.
That she may have internalized a fairly difficult picture of who she should be. And so maybe some of it, because you think about it,
right.
This is all completely, off the cuff, but she was in trouble for stealing that necklace.
Right.
And that's interesting because I assume she has money.
Yes.
So she could have bought the necklace.
Absolutely.
And yet let's assume that she did steal it.
Based on what we've learned.
Yeah, we don't know,
we
but
don't know.
let's assume she did. There's another symptom. Why would somebody who has money steal a necklace? And so again, if we wanted to pull the Freudian lens, we could say we suddenly have an acting out behavior that is symptomatic, and it may say something about maybe the way she's navigating these expectations.
Right.
Right?
Right, yeah, and I think this is kind of an adjustment. It's the course, she's maybe so far off course that, when she tried the attempts to do these kinds of things, or any of these stars do these things that are just so far, they're either legal, so far out of the normal kind of things that you expect from folks of this age, but illegal, substance abuse, any of those kind of behaviors, I think, are suspect for really connecting to this development, this lack of development, this very abnormal, if you will, trajectory for their personality. And
again, I would take that and say abnormal, and it also reflects the way in which our development is ubiquitously abnormal, because there are cultural expectations, there are double binds that we're placed in. And I might say that particularly there's an interesting double bind that I think that women are placed in around sexuality that maybe men aren't necessarily placed in. I remember reading, and this was from a religious text, it's a few years old, but that, for instance, boys are allowed to masturbate because they need because they're wired that way. However, women, they don't need to, so therefore it's a sin. And so again, there's an interesting there's something dangerous about women that isn't necessarily so, with lots of mixed messages around that sort of thing.
Mm-hmm, mm-hmm. Well, I think that you've got a point, and I don't know the answer to any of that. I think we've kind of explained it from a Freudian point of view,
and there's another point of view.
And there another one? Yes, probably, but probably so. I think what do you offer as a course of treatment? Last week we were talking about the celebrity and the
good old Charlie.
It was Charlie Sheen, and you asked me questions about, well, what would I do if I had Charlie in treatment? He was my client. I guess maybe let me ask you that question. If you had this person, this iCarly star in your practice, then where might you go, knowing that you've talked about double standards for women in here? You talked about the celebrity piece that is sort of abnormal, if you can use that term, or unconventional. How would you approach this, and what might be your plan to deal with her?
Well, for one thing, I would raise my fee before I actually saw her, because she could afford Actually, I can't. That's
There
by the
you
way,
go.
that's unethical. You can't raise your
You
fee.
can't raise your fees based on that.
Yeah, that's right.
You can't
That
do
was all a joke.
That was the joke.
April Fools.
That's right.
What I might suggest first and foremost, I think that there is a level of acceptance.
Right.
I do a lot of work with adolescents, both men and women, girls and boys, and I think that being able to create a space where it is non-judgmental,
Right.
and where you can actively normalize the conflict, where you can you certainly don't want to. There's a saying in the psychoanalytic literature that you don't want to side with the superego, the ego, or the id. You want to
Okay.
maintain some neutrality.
Right.
What that basically means is, if you want to maybe contemporize that, is you want to be able to acknowledge the fact that some sort of conflict and ambivalence is normal and necessary. And to be able to say, you know, it really is kind of screwed up the way we do things, and you may feel screwed up about certain things. I think that's
Right.
the first and most important step.
Right.
With some adolescents, there's a next step, and that is an act of maybe putting some things into words.
Okay.
They may have feelings of shame. They may have feelings of, for instance, I can think of several adolescent girls I've worked with who acted out sexually. They were being promiscuous.
Right.
And to be able to help them to put into words instead of action the things they were doing.
Right.
So, for instance, for them to be able to realize that they found a way to answer shame by the momentary acceptance of a sexual partner. So the moment that someone decides that they want to be with them sexually, at least for a brief moment, they feel love and connection. And they were answering an older shame about how they feel about themselves, and it sort of creates a spiral of doom. So there's an act of interpretation. There's an act of being able to put that into words and helping them understand what sort of affect or feeling may be motivating certain behaviors. And I think that's an important piece. So I think the acceptance,
Right.
and then there may be an interpretive piece where you have to really sort of get them to put into words what exactly they're trying to fix by the repetitive actions that they're engaged in.
Right. You know, I was wondering how power fits in with this too, just power and control in a person's life. If you're in that movie star track and you know, all your needs are met, so to speak, or you have a lot of money and things come easy, you got someone helping you through the high school and the school work and all the things you have to do, and you have less and less responsibility because you got a role to play on a television show or a movie. You know, it's almost a displacement, this notion of, you know, we talk about this with children and going through divorce, that sometimes they become parentified, you know, and they all of a sudden get elevated in power and status, and that it's very difficult for the person to kind of come back and really be back at the point of development to be the child at the age that they are, and to enjoy life and to move through in a normal fashion. And so I'm wondering if some of the power that comes with being these celebs that we've talked about here really come out and interfere with the process in terms of them accepting therapy or looking at themselves on the inside, and those kinds of things that we've talked about on the shows before. So what's your take on this notion that maybe some of this issue has to do with power and control?
Well, it's funny because when you're saying that, the first thing that came to my mind, again, it's a Freudian concept, if I might, again, because all roads lead to Freud. There's an idea in psychoanalytic thought about, it's called the Oedipal victory, and it's when basically the child becomes parentified, when the child is placed in a role above and beyond its developmental or emotional capacity. And so when you're talking about some of these Hollywood guys and gals, I think that there's a way in which they get power very soon. They become wealthy, far beyond their developmental capacity to be able to integrate that or to be able to move smoothly through that into levels of maturity. So I would imagine that if I had someone like that as a patient who came, and I have in my private practice here, and when I was particularly when I was in Miami, I did some work with children of the uber wealthy.
Okay.
And these aren't necessarily movie stars and whatnot, but there was a sense in which
sense of entitlement.
Entitlement.
Okay.
And it's a Pyrrhic victory, because, and that's the essence of an Oedipal victory. It's a wonderful conundrum, because you lose so much by winning. And I think that what often happens is with these individuals, it requires active work to get them to to be weak in front of you, to get them to be able to regress, to get them to be able to, there's a way in which they have developed this sort of character armor of entitlement and, like you mentioned, power and control. And you can, again, you can be accepting, but you can also, again, it's sort of a psychoanalytic thing, but you move to an interpretive place where you can sort of point out that, you know, to say to someone, you know, I think it's not easy to be here right now, and I think that for you to really be open and honest with me would require you to be weak in ways that you're not comfortable. Right. To point out that if someone, I can think of an example of a patient that I worked with in Miami many moons ago, was telling me stories about how they were, as kids, teasing the gardener. Right. You know, and how they were making fun of the gardener, and, you know, and how they had, you know, what the gardener couldn't do anything because they were paying them. And again, thinking psychoanalytically, I place myself in that story. I'm the gardener. Once again, they have someone that they're paying to be able to do something. And I brought it up. I said, well, you know, how are you making fun of me? I mean, this is something. And it was interesting to see that transition and to be able to talk about, to have this individual say, well, you know, the reason why I was making fun of the gardener is because my mom and my dad were never there. I mean, there was this hole in my life where my parents used to be. Yeah. And so even though I was being mean to the gardener, what I was really hoping for was someone to be able to notice me, an adult. Kind
of step in and help control and give some guidelines to, et cetera. Yeah.
So again, the story of the gardener opened up a space to talk about what it was like in the here and now, and it opened up a space for some old hurts. And it really helped illuminate a pattern of behavior that was getting this individual into a great deal of trouble with authority at school and that sort of thing.
Well, that's an interesting story, because I mean we started talking about today this double standard for these tweens.
Yeah.
All right, I was just making sure I was.
Which is culturally, by the way, when we were growing up, tweens didn't exist, right?
No, as far as I remember.
So
no.
Once again, just like adolescence is actually historically fairly new. There was a point at which, you know, you were a kid and then you were an adult. We've now expanded adolescence to include tweens. So there's this. I'm sorry, I just wanted to throw that out. That's
we were always learning. These shows are all about us learning, sharing information around.
Or just making crap up.
Or just telling some jokes. I think that Mickey Rooney thing you said earlier, I'm not sure.
I did say, by the way, that, you know, he did eat his gardener. I just want you to. Was it a gardener? No, pool boy.
You know, yeah,
he ate his pool boy.
Yeah. So the gardener thing may have been something you need to work through on this,
maybe.
but we'll get back to that.
That was a Freudian slip.
That was a slip. Another Freudian reference.
I'm sorry. I completely derailed your chain of thought.
Well, no, I was just recapping a little bit. We were talking about this dual sexuality position, this conflict that young women are put in as they move through, and then particularly the tweens, the Hollywood starlets and celebs, and the additional conflicts that they have with being rich, powerful through this, and the lack of some constraint, but also just some feedback in how people kind of adjust, and that's what our family members do to us, and our peer groups and others do to us in our relationships, kind of help us kind of adjust and really kind of chart a course that is appropriate for us, and that's missing in this process. Now, you know, finally, just to say, I'll ask one more question as we kind of conclude here today. But all right, so some of the theorists, Freudian, would say that there's something missing, or it gets fixated, or it gets stopped at some point in their development. Is it true that they need to go back and relive, refine that, work through that fixed point in time for them to move on and to be healthy as an adult?
You know, there was a time where there was this notion. It's often referred to as the corrective emotional experience.
Right.
As if somehow you had to sort of regress back to this point. You know, I think that's really sort of an antiquated notion.
Okay.
It's sort of in some ways, I think it oversimplifies. In the example that I gave with the kid who teased his gardener, he didn't necessarily have to go back and relive anything because it was in the here and now. Mm-hmm. There is a map at which he operates that if we listen for, we can hear it happening in the here and now. So we could actually catch it as it was happening. So we really only had to go back like 5 minutes. And I think with most patterns of behavior that are problematic, you really only have to go back about 5 minutes to be able to say, look what just happened here between us. And if you can create a space where you can do that in a way that is affirmative and supportive, if you want to be cliched or touchy-feely, loving, as it were, you can create a space where you can acknowledge things you couldn't otherwise acknowledge. And it doesn't necessarily have to be, you know, tell me about your mom, or let's go back to how you were toilet trained when you were 3 years old.
There. So it could be a short amount of time in there. All right, well, that helps me understand, and I appreciate this conversation today. And we have another conversation coming up that I want to talk about, and coming up in the show next week or soon. And that you mentioned a little bit in a reference about religion and judgment. And I want to talk a little bit about that in our next show. So we're going to
religion and judgment.
Religious judgment,
you know,
as a matter of fact.
To be really interested to know what Freud said about that.
I think you probably have a notion about that. So we're going to come back to that next time. But this is your show. You get to sign off.
I'll make it end. Listen, you've wasted another perfectly good, I don't know how many minutes.
A few minutes, yes, absolutely.
And you've learned some wonderful things about how development in and of itself is a difficult thing. It can be derailed. And you also learned that Mickey Rooney ate his pool boy.
No
and
idea.
We'll talk about that at some point, too. That's an interesting symptom.
I'm sure.
Until next time.